there's still a lot we don't know about the female menstrual cycle. In fact, last week we revealed that menstrual products like tampons aren't even tested using menstrual blood, which has led to inaccurate absorbency claims. Dr. Sara Naseri has been working to close this research gap. She's the CEO and founder of Qvin, a biotech company that's the first service to use a woman's period as a non-invasive blood test. And though Naseri's proven that it's not the waste product science has always believed, she says the topic of menstrual blood is still considered taboo and shameful in many parts of the world.
Because it's been sort of regarded as a waste product, I don't think for some reason it just hasn't been top of mind that this is blood and it could have tremendous value for patients and really help make healthcare accessible to women. And so I have asked myself many times, why has this not happened before? As a woman, as a doctor, it shocks me, even now having sort of been involved with this for, about 10 years, it still today shocks me. And I get almost goosebumps just thinking about it, that it is just unacceptable, frankly, that it hasn't been looked at. It took so long to really start understanding this very basic part of women biology.
Qvin's latest product, the Q-Pad, is the first and only FDA-cleared menstrual pad that collects blood for lab testing. It's a needle-free way of managing health that removes common barriers to healthcare.
We hear a lot of women wanting to take control of their health. I want to know what's going on in my body. I don't want to have to ask permission. Maybe certain parts of the population feeling to some extent overlooked by the medical community, and they want to be able to sort of do it on their own terms. And that's a patient group or a particular group of women that I think they really are excited about this opportunity because they can do it themselves. There's no having to go down and convince a doctor that I am tired. I really want to know my iron level. They can sort of monitor some of these things on their own.
The process is simple. Wear the Q-Pad for 2 to 4 hours during your period, pull out the collection strip hidden in the center of the pad and send it off to the lab. No need to schedule an appointment or interrupt your day. The pad is currently FDA cleared for hemoglobin A1C testing, which measures your average blood sugar. It's a common test used to diagnose and manage type 1 and 2 diabetes. And though Naseri's product is up and running, it had a rocky start. In fact, the idea for the Q-Pad didn't come until after Naseri had done research on menstrual blood in general, since there was such little research on the fluid. Scientists were still asking the question, is period blood actual blood?
We were starting from the basics, right? It was very much level 1 or level 0, maybe even level -10, asking those basic questions to even understand what is the composition, let alone how does it actually have clinical value for patients and how can it be valuable for patients? And I think that part of the question only started much later, frankly. Like the very first part of getting into this area of women's health was really the fundamentals. There is just a massive gap in the data when it comes to, I would say, fairly basic women's health issues or even fairly basic women's biology, female biology.
The obstacles weren't just in the lack of prior information. When Naseri and her team were working to get a grant for the initial research, a chief scientific officer remarked that he didn't believe it was possible to get health information from menstrual blood.
It was the first time that I was like, this is not about opinion or religion, frankly. It's not about believing. It's about the data. And the data is there. And it's showing that there is value and that we can find very specific biomarkers that we would monitor anyways, and now doing it in a way that is so non-invasive.
And yet, the team continued to find pushback at each turn. The culturally ingrained idea that menstruation is dirty or gross was evident even in laboratory settings.
Early on, laboratories were difficult, even big laboratories that you would think research laboratories at very innovative areas of the world. I had a colleague who was doing research in feces, and I remember sharing that I was going to go do this research, and sort of this colleague looking at me and literally saying, "That's gross." And I was like, "You work with feces every day. What are you talking about?" One lab was very worried that this would dirty up their machines or ruin their machines and stuff like that. We were starting from ground zero.
The team realized that in order to truly achieve what they set out to, they need to have full control over their own space. And so they ended up building their own lab. Through her research, Naseri was able to finally answer the question once and for all that period blood is, in fact, real blood. Since it also includes endometrial tissue and vaginal fluid, it's not exactly the same as the rest of the blood in our bodies, but Naseri believes those differences make it possible to detect biomarkers that blood from a vein cannot.
hemoglobin A1C is the biomarker that is available right now. Then there's other areas such as looking at something like cervical cancer screening, where you cannot get that from a venous blood draw. You'd have to go in, do the pap smear, you collect some sample from your cervix, and we run testing on that. And of course, what's really exciting is to see that we are actually able to monitor and screen for cervical cancer very accurately with the QPAD. We are only scratching the surface of what's possible. We've looked at the inflammatory profile of menstrual blood, and we're seeing some very interesting things there in terms of could this be helpful in diagnosing endometriosis, fibroids, and stuff like that. Still in the early stages of these kinds of areas of women's health. But I would say there's just so much that this bodily fluid can tell us about our reproductive organs.
Naseri's research has begun to change the conversation around menstruation. The bodily fluid that's long been thought to hold no value at all may just be the best way for women to monitor their health.
The hope behind Qvin is that we can help make healthcare accessible to women. And this is just such an accessible bodily fluid. It comes every month. You don't have to do anything. You don't have to prick your finger. You don't have to handle anything. It's very basic, very simple, right? When we do usability studies, which of course is a big part of what we do, and one of the big feedbacks that we receive from women were, I know how to use the QPAD. I know how to use menstrual pad. I've been collecting my menstrual blood for many years. It's not sort of unknown. I think that's the beauty of the product, is that this medical device, if you will, is really that it's so simple. One patient that had reported back that what she loved about it was that it was passive collection. I don't have to do anything. It comes whether I want it or not, frankly, right? And I think that really can open up for healthcare accessibility, not just in the US, but also on a global scale.
Naseri hopes it will also change how women think about their monthly periods.
Hopefully the next generation will look at this event that happens as an opportunity, as something that we have as women or females that, is a window into our health that we get every month that frankly males don't have. And that's an exciting way to look at it, rather than I'm having my period and it's maybe not so positively viewed. And I hope this really can change that conversation a little bit.
You can find more information about Dr. Sara Naseri and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.